If you are experiencing one of the worst abdominal pain ever in your life, possibly you're suffering from kidney stone, and you are not alone. A lot of us will end up having similar pain. In this video, I want to provide you with tips and tricks which you could use to help your body to pass the stone naturally and normally with least amount of discomfort at home. And we will also go through some red flag signs which you should not ignore. What is kidney stone? Kidney stone is a deposition of minerals and salts in your genitourinary system, which involves anywhere from kidneys, kidney pelvis, ureters, bladder, and urethra. Depending on where the stone is and how big it is, you will have the symptoms. Smaller stones are apt to move, and when they move, they lead to a lot of pain. So don't go by the size. Smaller stones are more painful, but you have the advantage that they are more apt to be passed through your system. Whenever you have a stone in your kidney, pelvis, or upper ureter, the pain is usually in your lumbar region and going to the groin. Because embryologically, your kidneys, your upper ureters, they have a different set of nerve fibers and they go to different parts of the body. Middle ureter goes to different nerve fibers and the lower third goes to different nerve regions. Because they are innervated by different nerve roots, so the radiation of the pain is different. Whenever you have a pain which is primarily in the kidney pelvis and the upper third of the ureter, pain is usually in the lumbar region and groin. When pain is in the middle, it is usually lower abdomen and sometimes it goes to the bladder, and lower third can go to your privates and you feel bladder discomfort. If the stone is in the bladder, you will have a lot of urge to urinate, and in the urethra, when it's about to pass, you will have a lot of burning on urination. The symptoms guide us the journey of the stone. So pay attention to where you are having a pain and where the pain is being radiating. What can you do at home? I think before you start treating yourself, I want you to be aware of certain things which are very, very important and you must not ignore. If you start running fever, this means that stone is blocking the flow of your urine and it is getting infected. Kidney infections leading to kidney damage, kidney failure, sepsis, and death is a very, very treatable condition. But at the same time, if you ignore it, you could be having a permanent damage. Second, if the pain is consistent and anything you do at home is not working, that is something not to fool around. You must go to the emergency room or go to your doctor's office so that they could help you. At home, what you are trying to do is you are trying to help your anatomy take care of the things itself. If the stone size is too big, pain will be persistent and it will not fluctuate and it will stay there for a long time. That is also one of the reasons you should ask for medical help. But if the pain is fluctuating, then the possibility is based on the size of the stone that you may pass. I keep on referring the size of the stone. There is no way at home you will be able to know, or I cannot give you any sign and symptom which will indicate that what will be the projected size of the stone. Most of the time, we do CAT scan without contrast with stone protocol to diagnose kidney stones. Any stone which is less than 5 millimeter is passable, meaning the ureter lumen is big enough that the stone will move through ureters and eventually you will pass. That is the only place I truly believe remedies at home will work. If your stone size is between 5 to 7, you have some chance of passing it. You may need procedure. Any stone which is more than 1 centimeter or 10 millimeter, you will not pass and you will need urological consultation and help. What are the things you could do is number one, take pain medication because that relaxes the muscles and the ureter. When you are not in pain, the spasms go away and that will naturally increase the lumen of your ureters. Second, hydration. That will provide increased urine flow and that will help to pass the urine. Second, lemon juice and citrate. Lemon juice is very helpful because that decreases the oxalate load in the urine and it will help to pass the urine. Then movements, when you're moving, stretching, that also help to relax the muscles and it will help you to passing the stone. Warm compresses, hot showers, they are also shown sometime to help you aiding the passing these stones. If you start having persistent fever and persistent pain, please do not ignore, ask for help. If you want to prevent kidney stones for future, keep yourself hydrated, prevent certain kind of foods which your physician will guide you based on kind of stone they found out on chemical analysis. We will link another video where we go over different kind of stones and you will be able to help to change your diet and do proper diet modification to prevent it for future. General rule of thumb is keep yourself hydrated, decrease sodium, regular potassium diet. That will help you a lot. If you like this video, please do not forget to subscribe, like, and share. Please do comment on content because that keeps us motivated and we will continue to serve you. Thank you very much, and I will see you in next video.